Compared to boys, about 34% of adolescent girls under the age of 24 experience sexual violence in Namibia, and most new infections are recorded amongst young women aged between 15 and 24. Statistics show girls account for 75% of new HIV infections every year among adolescents in sub-Saharan Africa, while testing and treatment continues to be low among these age groups. In much of sub-Saharan Africa, young people are highly vulnerable to HIV infections for both cultural and economic reasons, and many of these young girls are not aware of their HIV status. Despite considerable progress in HIV care and treatment, there is an urgent need to address innovative HIV prevention interventions and approaches to reach adolescent girls and young women.
We still have young people being tormented by especially older nurses and doctors who are scolding them. 16-year-old come to the clinic wanting a contraceptive. The response is an immense tormenting. It's a right. We rather have this burden of new infection among young people rather than opening up. But we're wasting time with some cultural, spiritual, whatever means to contain our young people in cocoons.
Although some still have doubts as to whether the HIV virus can be prevented sooner or if any approaches will be effective, UNAIDS regional representative Sheila Tlo strongly believes it's time to get going and make a change at country levels.
How do we push them? What are the indicators at country level that we are doing okay? Do we have a baseline to be able to measure those indicators? I'd like us to, doing that, because now we have a guide. We have the Sustainable Development Goals and AIDS as a public health threat by 2030. And now, we're having prevention meetings that are saying, let's make sure we end HIV. And I think we can be able to do that.
The meeting is organized by the Ministry of Health and Social Services in partnership with the World Health Organization, UNAIDS, PEPFAR, and USAID. Siamantikwa, NBC News, Windhoek.